Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about post-ablation syndrome. That's post-ablation is for an endometrial ablation, and post-ablation syndrome is a complication that occurs afterwards. It can be a few years after, that can cause significant pain, bleeding, and discomfort. There is another video, if you've seen of the endometrial thermal ablation procedure. I usually use in my practice the NovaSure ablation. I'm a big fan of that procedure. It works really well, highly effective, has about a 95% rate of women pleased that they got it, and about 70% of women who have no bleeding at all. So 25% get much improved bleeding, but they still bleed some. It is one of the side effects, though, and variously quoted as less than 1% or 1 to 3% of a risk factor of later developing post-ablation syndrome, and that's what I want to get into today. There's also a related condition called post-ablation tubal ligation syndrome, or tubal sterilization syndrome. So when you're in your menstrual cycle, the lining of the uterus is called the endometrium, and that gets thick in preparation for pregnancy. And when there's no pregnancy, that lining sheds. So it's more than just blood, it's actually the lining shedding. That lining is a rich garden for the egg to implant in, okay? So when we do a thermal ablation, we put an instrument inside that destroys the lining of the uterus. There are different procedures with water, with radio frequency, with electricity, with heat, but the one I use is called the NovaSure ablation. It's a device that's triangular shaped and just heats up and destroys the lining of the uterus. And it's simple and quite successful. However, it often can't get all of the tissue, and usually that doesn't do anything, but sometimes a little bit of that tissue remains behind and starts to grow or regenerate or come back. And it's enough that it causes bleeding inside the uterus, but the rest of the uterus is scarred, so it's kind of a closed container, and that builds up pressure, and that pressure causes cramping. And sometimes eventually it kind of burrows its way through the scar and comes out and causes some bleeding, and that's why it often looks like a dark, old-looking blood, and that can cause the discomfort and be an indication of post-ablation syndrome. If you've had an ablation and it's a little while later and the cramping's not gone away, or you're doing well and after a few years you notice bleeding coming and then you get severe cramping, the first line intervention is non-steroidal anti-inflammatories like Advil, ibuprofen. That doesn't get you better. We would do an ultrasound, and you can see your physician. I recommend that you see them to discuss it with them. And they do an ultrasound, and they can look and they can see this potential collection of fluid. It can also cause the lining of the uterus to grow into the uterus. That's something called adenomyosis. A little higher chance if you had a C-section to grow in the scar of the C-section. If that occurs, then there is the potential to try some medications to suppress it, like progesterone or the birth control pill, but usually that's not the case of what we end up doing. And often the only resolution, if it's severe enough, is to get a hysterectomy. You remove the uterus, no more lining, no more cramping, uterus gone. If you're young enough, we would probably recommend leaving your ovaries. So it is usually the way that that gets resolved, and thankfully we don't see it too often. The closely related post-ablation tubal sterilization syndrome is when we get the ablation first, it's too dangerous to have pregnancy afterwards, so we will often do a tubal removal. It's called a salpingectomy. But if you had the ablation and you had your tubes tied, then there is some tube left. There is, when they're tied, if my arm is the tube, when you tie them, you take out the midsection and tie there and there, and tubal removal, which you can see in the sterilization, is just taking the entire tube out. So if we tie them, if they're tied, then you have a small section of the tube there, and that can allow a little bit of that tissue or the bleeding to backtrack into the tube, or that the lining of the tube can grow in and it secretes a little fluid, and that can create what's called a hydrosalpinx, and an enlarged tube that is painful, uncomfortable, can cause bleeding and discomfort as well. Similar treatment, similar diagnosis, depending. Sometimes the tube can be removed and not need a hysterectomy to solve the problem, but they're very similar, and usually, if not able to be easily treated with the pain medicine for a couple of days, it needs a surgical intervention. Certainly warrants you going back and seeing your physician who performed your surgery or another gynecologist to resolve it for you. It's thankfully doesn't happen too often, but it is something to consider as one of the potential risk factors if you're thinking about getting an ablation. And if you have one and you have these symptoms, definitely worth going to see your physician and to see if that's the case. There can be other things. Your ovaries are still working. They can make cysts. There's ovulation, and that can be treated with birth control pills. So it's not a certainty that you're going to need a surgery, but it's a possibility. I hope you found this information of use. Please leave your comments. Thank you.